I just wanted to point out that beta-caryophyllene is highly effective in orchestrating the genetics or the epigenetics of the body. It is magnificent for regulating the DNA. And in cancer cells, and this is a paradox, in cancer cells, it causes damage and destruction to the cancer cell. But in normal tissues, it restores the DNA and rebalances. So you don't get the same effect at all. And you get restoration. Plus, there's a number of different epigenetic factors that it orchestrates, including different gene structures that it activates and different gene structures that it deactivates. And so these are all very positive events that are going on. But that is a profound effect of the epigenetic factors for beta-caryophyllene.
Was it apoptosis?
Yes.
That's when
That's what cancer cells are instructed to die from the DNA fragmentations, apoptosis. Yes.
Apoptosis, yeah. Wow. That's absolutely amazing. I can't wait to hear more all about this.
Honey knows, yeah, honey shows what it means to lead when the medicine grows with grace and grit and truth as her guide. She's the queen of the green with nothing to hide. Oh, honey knows.
Hello, my friends. Today I have the absolute honor of welcoming a very special guest, Dr. Philip Blair, MD. He's of the Blair Medical Group and the creator of BC+. You've heard me talk about that time and time again. Dr. Blair is a physician who has dedicated his work to understanding the body in a more complete and compassionate way, especially through the lens of the endocannabinoid system and its role in healing. I've been using BC Plus as part of my daily wellness routine for over a year now. And I'll tell you more about that later, but I could not feel better than I do because of it. Emotionally, physically, all things just feel so much different to me now by using that product. And I don't want to be without it. The way it has supported me with anxiety and pain and inflammation has been profound enough that I chose to become an affiliate. Not because I had to, but because I truly believe in this product and the power of this compound to help people, not just people, but our society. It's an alternative to what has never been enough to help women through womaning. So today we're going to talk about this compound, beta-caryophyllene, and we call it BCP for short, and explore how it works in our body and what it may offer you, and especially those people who are navigating serious health challenges like cancer. Help me welcome Dr. Blair, won't you? Thank you.
Honey knows, yeah, honey shows.
There we go. I'm just so tickled to have you here. I want you to know that. We love the information that you give us, Dr. Blair, and it is absolutely so essential to get this information out to women in general, I feel, because we haven't had any help or alternatives to what's been happening with us through our stages of womanhood. And so to find you and the help that you've created for us and the science behind all of it is absolutely fascinating. And I'm so grateful you're here to help explain all that.
Well, honey, I'm delighted to be with you, and I enjoy these in-depth conversations that I can speak to women of all ages, and I can make an impact about the endocannabinoid system and beta-caryophyllene. I feel it is really valuable as an educational standpoint for everybody who you lead to your podcast.
Yeah, I'm just so tickled to be able to present something to a friend. I'm with women all day long out at work, and they're stressed to the max. They take pills when they get home, and they use alcohol to try to, do the work that they're not getting help from big pharma in. So the things that they're doing to themselves are more damaging than anything. And it's so wonderful to say, hey, I don't have to do all of that. And I've got a big alternative that I want to tell you about.
Hmm.
And so this is really, really important news for women of all ages, like you said. Now, I don't want to miss anything, Dr. Blair. So I wrote down a few questions, and I hope you don't mind if I just read off of these questions so that we can really get the whole scope of this information out. Is that okay?
You bet. Oh, yeah. Yeah. But do want to point out that beta caryophyllene could replace many of those standard medications that are so frequently prescribed by family practitioners or psychiatry or internal medicine or OBGYN. There's so many things that beta caryophyllene can do. You just have to get in and try it and recognize those particular benefits. Now, honey, have you noticed have you been able to de-prescribe different medications for yourself?
Oh, well, yeah. And it's no big secret that I've been on beta caryophyllene and specifically BC Plus, your product, for well over a year, I think. And I just don't want to live without it. I told you a little story that at work, I'm a cashier at Kroger's, and I see women stressed to the max all day long. And they are just fidgeting and frustrated and angry. And I want to let them know that this is an alternative to all of that mess that they're going through. They could have the bliss that I feel and the focus and the energy and the painlessness that I have throughout their entire workday, throughout their entire personal day, and have a good night's sleep as well on top of that, which of course is so restorative.
Yes,
So,
absolutely.
yeah, you and I've done this before, and I've talked about all the benefits that I've personally received from instant help with depression, instant help with anxiety, which is an ongoing daily thing for me because anxiety is palpable. That's like a wave on water that
Mhm.
just emanates from you, and it's palpable, and it feels so icky when it's coming at you. And if it's going to be coming at you all day long, well, wow, all I can tell you is I'm armored now. I don't take that anxiety on because my nervous system has been settled properly
Mhm.
with this compound. So I'm such a blabbermouth about it. Let me ask you the question.
All right.
And let's go back to basics, just for those who are brand new and have never heard of what you and I are talking about, beta caryophyllene, great big multisyllable word that we shorten to BCP.
ACP.
And Dr. Blair created a product that we can use of BCP that he calls BC Plus. So we'll get to that later. But what is beta caryophyllene in plain English?
Well, it's a aromatic essential oil. It's found in numerous plants and vegetables, but it's only 15 carbons, so it's a very simple molecule, but it has a huge impact on the body with over 100 different connections across the body that are all beneficial in my experience.
Where does BCP come from naturally?
Well, it's found in probably 1,000 different plants, but primarily it's found in cloves, black pepper, oregano, basil. It's in grapefruit. It's in frankincense and myrrh.
So we get it in everyday food all the time.
Yes,
we've been using it always. It's always been in our bodies.
Right. You've been getting it, but you don't realize it. And it's not as highly bioavailable. All these are nutritious herbs and spices like cinnamon. They're nutritious, they're rewarding, but you just can't get enough of them to make a huge impact on your body. You can get a little bit in, and they're all associated with healthy foods. For instance, the Mediterranean diet is full of beta caryophyllene, but people don't recognize that.
Oh, lightning going off in my head. Yeah, wow.
And in addition, olive oil actually stimulates the CB2 receptors, and so it proliferates CB2 receptors, which are the primary engagement and activation for beta caryophyllene. So you're getting a stimulation of the receptors as well as the benefits of the caryophyllene in the compounds in the Mediterranean diet.
Okay, so CB receptors. Can you tell our audience what those are?
Yeah. So it's like a lock. It's like a key and a lock. So the lock is the CB receptors, the cannabinoid type 1 and type 2 receptors. Now, BCP actually connects to the CB2 receptor very specifically, but it does not connect at all to the CB1 receptor. Now, the CB1 receptor is one that makes you high and can provide intoxicating effects, whereas the CB2 is associated with anti-inflammation. It's on every one of our immune cells, and it turns off the immune reaction that we commonly get and shifts it over from the active phase of inflammation over to the healing and resolution phase of the body.
What does inflammation have to do with anxiety? Something.
A lot. Anxiety and depression are essentially an inflammatory condition of the neurologic system.
I'm lightning. Wow. Okay.
And that's why BCP, with its connections to the CB2 receptors, calms down anxiety and depression immediately. Because it registers that receptor, the CB2 receptor, that quiets down the brain from anxiety and depression by correcting for the inflammation, the neuroinflammation.
And when Dr. Blair says immediately, I can attest to that, because I can take a dropper of this and instantly I feel relief. I just rub it around on the insides of my cheeks, and I literally, within seconds, I start feeling this relief.
Not only that, it actually calms your stress hormones as well. It reduces epinephrine and cortisol. So it calms those down as well. So you're not getting that fight or flight symptoms at the same time. So it's going to calm inflammation. It's going to calm anxiety. It's going to calm this stimulation of the fight or flight hormone regulation. And it's going to quiet things down to have you with the ability to focus on those tasks at hand and use your prefrontal cortex to coordinate the logical decisions.
So you couldn't do all of that and be high. And like you said, it doesn't go to the receptors where you get high. It goes to the receptors where it's healing inflammatory issues.
Exactly. Now, that doesn't mean that it doesn't make you feel good. There's feelings of well-being. There's feelings of
I'll tell you there are.
Of
joy and bliss.
Joy, bliss,
happiness,
and gratitude. Gratitude is a very unique emotion that actually connects up with the limbic system of the brain, the one that we feel most of our emotions from.
You can recognize gratitude on a biological level?
Yes, it actually can be recognized on functional MRIs.
Oh my goodness.
So it's a combination of the VTA, the ventral tegmental area, the nucleus accumbens, and the stratium and the prefrontal cortex. And those things combine to give us a calming and relaxing sensation without the rush of dopamine that often stimulates the sort of bizarre sensations. But it also incorporates the prefrontal cortex for decision making and judgment.
You're just talking sexy brain talk now. Listen to you. That is the most fascinating thing I've heard all day. And you always shock me with new information like, well, it's new information. The lightning in my head is going off on it anyway.
Honey knows, yeah, honey shows.
Hello, my friends. I'm getting ready to put my feet up by the fire and cozy up to a good book, which reminded me you should do the same with my good book. This powerfully packed, little itty bitty 120-page book is going to give you a foundation in this gentle plant therapy we all know as cannabis. Not only that, it's already been peer-reviewed by doctors and scientists and other cannabis professionals in this industry. Furthermore, you're going to find out who my favorite professionals are in this industry and how they could possibly help you, because I list those sources. You'll find out their names, their websites, what medications would be available for you, all amazing information. And it's just a couple hours read. Don't miss Understanding the history, politics, science, and protocol of using cannabis safely and effectively for yourself. Anywhere you order books online. Healing Beyond High. Cannabis Truth. If you're not able to use cannabis, you could use a terpene, this one in particular, that will help you with inflammation and pain, acute pain, and like nausea and anxiety. It is an amazing product I don't want to be without, because it made me realize what an anxious woman I was when I wasn't using it. I mean, I started using this for the pain in my hands, and yeah, it helps a ton, but when I realized that it absolutely got rid of the anxiety I was feeling, I don't ever want to be without it. Turns out, after all the work I've been doing over the past couple of years for, my inner child and fixing all of that, I was such an anxious woman, I had no idea. But when I use this, that's all gone. It's just gone. I hope you too go look up Dr. Blair's. It's called Able Docs Apothecary is the name of his company. You can find him at Blair Medical Group as well. And the name of the product is BC Plus. It's a reference to beta caryophyllene. The terpene, beta caryophyllene, BC Plus. It's so cool.
Honey knows, yeah, honey shows.
I just want to say that I'm so tickled to have so much brand new understanding of my own body and how things function. And that's just a wonder in itself.
So one of the other things is dopamine. So dopamine is this excitatory molecule that if you get too much of it, it certainly provides a great deal of pleasure, but it also provides addiction. And whereas beta-caryophyllene reduces and tempers that dopamine so that we don't get addicted to different substances. And it is in fact anti-addictive for almost all compounds, including THC, as a matter of fact. Benzodiazepines, opioids, cocaine, methamphetamine, and nicotine. It's anti-addictive for all these substances, including food. So if you have sweets, if you have cravings, it'll actually block those cravings because it inhibits the dopamine, the high release of dopamine that is found in different addiction compounds, but it also is included in schizophrenia, where you have high dopamine surges as a result of, let's say, CB1 activation that can lead to schizophrenia. And this can actually dampen that effect BCP can dampen the effect on that release of dopamine and could dampen the effects of the psychosis as well.
If
More
I,
sexy brain talk.
yeah, really. And if I understand you correctly, I believe you just told me that BCP is an anti-addiction
Psychotic,
med,
anti-addicted,
right, for everything, and that
everything.
includes alcohol.
Yes.
Well, look at that. That is just amazing, isn't it? Yeah, I used to be quite a drinker before BCP, and I'm just not interested, I have to say.
And what kind of cravings did you used to have that you no longer have?
I used to be a big Dr. Pepper girl, and I just don't need it anymore. And
Yeah,
that's
that's the
something,
sweets. You can forego the sweets. You get this craving for refined carbohydrates. It just vanishes, and that's
right?
why people lose weight
Ah,
with beta carothylene as well.
there it is. Wow.
But we're talking about cancer.
Okay, thanks. Because Dr. Blair, if I did not take BC Plus on a daily basis, I would sob because I have so many friends who are suffering with cancer, different kinds, and terrible gastro problems that feel tumorish and cancerous and all that mess. Is BC Plus okay to use when my friends are going through cancer treatments?
I think everybody who has cancer or needs to prevent cancer should be on beta carothylene. The benefits are magnificent. It has no drug interactions, at least in a negative sense, but it has only positive effects, and it can quiet down the entire inflammatory signaling that goes on in the body, as well as protect normal tissues and enhance the killing of cancer cells.
I'm so happy to hear you say that. The anxiety created in the patients with cancer is also just huge. And when you get a
Diagnosis.
proclamation from the doctor that,
Mm.
you're at a stage 3 cancer or a stage 4, or they can't help you anymore, and you're just throwing your hands up and waiting to die, it's pretty scary and anxious for them.
So
So
beta caryophyllene can treat the symptoms of anxiety, depression, and pain, as well as the side effects and toxicity from the chemo and radiation. It can protect your body against those, as well as enhance the killing effect on cancer cells specifically, and enhance the chemotherapy on the cancer cells. So it's highly effective in all those three areas. And it works on cancer cells in a number of different ways that are really quite surprising.
do you have something that patients could take to their oncologist about um, BCP and what it could do for their patients?
Well, I do have a white paper that I can offer them. It's a one-page white paper that is an abstract of a document that I produced a number of years ago that lists off 10 specific benefits of beta caryophyllene and its anti-cancer effects specifically.
I think that would be wonderful, a wonderful place to start for anybody new to my audience, or here's an old friend with these issues to obtain and take to their doctor, and immediately start your own research into this compound and what it could do for you.
So I'm not recommending beta caryophyllene as the only substance that people need to use or want to use
All right.
with cancer. But I am suggesting that they speak with their clinicians about using it because it offers a great deal of benefits in terms of the symptoms of cancer, as well as, and I'm going to focus less on the anti-cancer effects, but more on its mitigation of the symptoms around cancer and the side effects from the chemotherapy.
What have you seen from your own patients?
Well, I've seen people specifically on breast cancer. I've been very successful in treating breast cancer. Most patients are able to go through the chemo and radiation therapy very, very smoothly without much in the way of hair loss or complications or pain. They will get a little bit of fatigue with it, but they generally sail through these treatments very effectively, and they almost everyone that I've treated with BCP and other agents, particularly CBD, have come out and they've gone into remission. So I'm very hopeful for them. Plus, I've kept them on, recommended they stay on the beta caryophyllene as a preventative against malignant transformation of the remaining cells that are in the body.
That is amazing news. I love hearing the stories about the progress of these people, these patients.
In
For
addition, I've treated glioblastoma, or at least brain cancers, with it, and it's been highly effective in brain cancer. It's remarkable the success that I've succeeded with it. In fact, these people have done extremely well, and they've gone back to their usual livelihood. One is a police officer, and he went into financial accounting as well, as he's progressed into that. And he was in his 70s when he did that.
oh my gosh, oh my goodness.
And lung cancer has been highly effective for lung cancer in particular. I've had some remarkable recoveries and remissions in lung cancer as well.
I'm thrilled to hear this, really, and so will our audience be. It's just such hopeful
Now,
news.
in each of these therapies were a combination therapy. Beta caryophyllene was an adjunct to the usual therapy. It had the ability to enhance the chemotherapy and radiation therapy and temper all of the side effects and avoid the complications from the chemotherapy agents. In fact, beta caryophyllene is is chemosensitizing to chemotherapy. It actually sensitizes the cancer cells to the impact of the chemotherapy agents by improving the absorption, the permeability of the cancer cell membranes to these chemotherapy agents. Now, there are seven that have been documented for the chemotherapy sensitization. And it also prevents the cancer cell from excreting the substance. So when a cancer cell realizes it's got a toxin inside of it and wants to get rid of it, it can't because the beta caryophyllene inhibits that ejection formula.
I'm just fascinated by all of this. I'd love to see the Hollywood version of what you just said.
Not only that, it is highly effective in tamoxifen therapy. It allows you to continue tamoxifen, which is a agent for cancer, breast cancer in particular, and people are placed on that with low levels of breast cancer or to prevent future breast cancer. Well, it actually it increases the absorption and decreases the ejection, and it actually sensitizes the cells to tamoxifen so that it prevents tolerance. So one of the problems with tamoxifen is that you only use it for 2 years because it sort of wears off because you develop tolerance to it. And you could inconceivably continue taking it with the preventative and the chemosensitizing effects of beta caryophyllene and tamoxifen.
That sounds like a wonderful prescription for the aftermath of all of that. Yeah.
Yeah, but it's very hard to enter into oncology. This is so controversial, and so you mentioned in your questions about well, how it's really popular. There isn't that much information about cancer out there, and the oncologists are very reluctant without placebo-controlled randomized
Oh,
trials, thousands of people involved. So it can't. We're not there yet. We're not of the awareness, and yet the literature is highly supportive of it. There's actually only 15 human studies on beta caryophyllene and human use of it, whereas there's several thousand other studies that have been done preclinically, but only 15 human studies, and they don't deal with cancer in general. So you can't really look at it for cancer. There's plenty of preclinical literature, and it could be highly effective, but nobody is willing to embrace it. In fact, the pharmaceutical industry has over 70 different compounds under development that are CB2 agonists. So they work on the CB2 receptors, but there are over 70 that have been incorporated into the pharmaceutical system, but they have not reached the phase 3 trials, and those that have reached the phase 3 trials have failed.
Oh, man. I hate jumping the gun, but gosh, I would think that the whole industry would be thrilled to have something to look at.
Not one that's going to take away from their profits.
It's already FDA approved. Doesn't that make a difference?
No.
I mean, we've been eating it for thousands of years.
It's approved as a generally regarded as safe substance, as a food flavoring. So that means you can take it into different things, and you have minimal amount of regulation on it, and so you can take it in as a raw oil, but the raw oil is not very effective. So you need to get it enhanced in some manner or form for bioavailability.
So that your body absorbs it better.
Yes. So a normal dose of beta-caryophyllene is on the order of 300 milligrams. But if you take 300 milligrams of beta-caryophyllene raw, you're probably going to get diarrhea. So what I've done is I've created highly bioavailable formulations in liquid as a liposome and in powder form, so that it's a highly bioavailable in a matter of minutes, absorbing through the mucous membranes and the gut, as well as the nasal passages and the airways. And in that form, it gets highly available to the body and circulates in the system, and it sort of bypasses the liver on first pass.
What's a liposome?
A liposome is a bubble-like arrangement that is formed from wrapping the molecule in a membrane-like structure that is water-soluble, but it contains fat. So it's a little bit like a soap bubble in that it can be absorbed into the body very, very effectively, and the body can take in the oil as if it were a membrane and get transmitted to the bloodstream, and the cellular capacity is enhanced with that.
Is it kind of like a wolf in sheep's clothes?
No, because it's really highly beneficial.
Yeah,
so it's pretty much a sheep in wolf clothes, I think.
I started to say it the other way around, a sheep in wolf's clothes. All right. It is absolutely factually amazing, this compound. And so how did you find it? How did you get started? How did this come to you? How did you learn that we need this and it's so wonderful?
Well, I started off with cannabidiol in 2014, and I had nothing to do with cannabis before then. But when I recognized the huge value of cannabidiol, I started researching that, and I learned all the benefits with regard to cannabidiol. Well, one of the key ingredients, one of the key entourage substances were the terpenes. And so I was exploring some of the terpenes, and I learned about caryophyllene from a chiropractor in Australia who was using it to treat cancer in his dog, and he had a huge success with that. So I was amazed, and I started doing some exploration over the years, and I started applying it in different ways, and I discovered that it had huge benefits for mood, anxiety, for pain, and oh, by the way, it has magnificent anti-inflammatory properties. And based on the literature, I incorporated it into cancer therapy along with CBD. And so CBD plus beta-caryophyllene is highly, highly effective. And I always recommend people use CBD and beta-caryophyllene side by side as a because it magnifies the benefits and the dosing effects of each of the compounds. For instance, if you would normally need 10 milligrams of BCP and 10 milligrams of cannabidiol, you can actually, when you combine them, you can reduce it down to like 1 or 2 milligrams and get the same level of benefits. And that's true for a number of different other problems as well, such as stroke and inflammation and serious other problems like Alzheimer's disease. I think you all benefit from a combination of those therapies that can be highly effective because they work a little bit on different receptor systems, and the combination is highly effective, and the magnification of the benefits is huge in that way.
Wow, just the combination. I'm trying not to say the entourage effect of those chemicals, but that's what it is, and how powerful they are together.
Right.
Yeah,
Right.
that's amazing. That is absolutely amazing. Where do you source from? How important is sourcing for this? And are there other companies out there that are doing this? And what's the difference between them and you?
Well, there's lots of different sources. There's black pepper and cloves, and those are the major sources. But it actually could come from guava leaves in particular. And there's a plant there's a tree in South America called the copaiba tree that produces huge amounts of beta-caryophyllene on the order of 30 to 50%. And all of these sources can be highly effective, it's found in about 30 plants in high concentrations. So any of these plants could have the BCP extracted from them and lead to systemic therapy for many people. The trick is that you've got to put it into a highly bioavailable format. Otherwise, you're not going to get the response that I'm seeing. Now, there's a couple other companies who have done such. They put it into a powdered form and they put it into liposomal form, but they don't have the same benefit that my products have, probably because of my experience of my manufacturer of the liposomes out of Colorado. He produces a highly effective bioavailable liposome that has been demonstrated at enhancing CBD absorption by 10 to 17 times in that way. And so he's using the same technique with the beta-caryophyllene, and I'm getting that same responsiveness of about 10 times the dosage of the beta-caryophyllene. So when you take 1 milliliter of BC plus, which is 30 milligrams, it's equivalent to 300 milligrams of the raw BCP.
Is there a patent on that liposome?
No, there isn't, because he's kept it proprietary and he hasn't put it in for a patent. He hasn't put it in for any procedural clarification, and nobody knows what he's doing with it.
It's amazing. It's just amazing. Boy, our society and how it works or doesn't work. I'm just so glad to be part of the procedure for help to get the information out so that more people can take advantage of this gentle plant therapy.
I completely agree with you. And that's the driving force behind my development of this product. I found it so pervasive in terms of its benefits and its prevention that I want to get it out to the world. And I've got a small business. I'm trying to promote it. I've been at this for over 5 years, and it really hasn't taken off. And I don't know why it hasn't really taken off, except that it's competing with cannabis, and it is relegated to the entourage effect, whereas it has unique properties of itself. And then there's the issue of a natural product becoming a huge nutritional supplement that has extraordinary value. It defies all logic in terms of its total benefit. And yet I've pointed this out to many people, but they don't seem to recognize it. Now, I understand, though, that not everybody gets the benefit from it. Probably 70% of people will get a specific benefit from using beta-caryophyllene. But then if you use it over time, it could be preventative and it could be protective on the body. Yet I haven't been able to penetrate the marketplace. Now, I've got it into two clinical studies right now. One is at Yale and examining it for chronic severe pain syndrome. And another one is in University of California at Irvine, who's examining it in relative to Gulf War injuries and Gulf War syndrome. That is a very common event right now.
I'm really pleased for you to hear that. Those studies are so needed, and you're leading the charge is all I can say. I know it's frustrating to be a small company and not feel like you're moving fast enough, but it's got to get there is all I can say. There's too many benefits, and it's too easy to create and obtain and distribute. So, for whatever reason, we just must keep on this march and this mission to get this information out.
You bet. Yeah.
Is there a specific way that people should take BCP? I take mine in drops. I felt like the pills, when I tried the pills, they may have been effective, but I didn't notice it instantly. So I was waiting, and then I got distracted. And then I don't know, did it work? I don't know. Okay, I'm going to sleep, And so I wasn't sure. I was never sure if pills worked for me. I love that instant gratification from this because you can really feel the anxiety go down. God, poof.
So any way that you can take in beta-caryophyllene, it can provide a benefit from it. You can take it in by taking the liposomes, and I typically tell people to hold it under their tongue or in their mouth for 1 minute and then swallow it. But you can also it's water soluble, so you can put it into a drink of your favorite flavor, and you can drink it that way. Or you could put it as salad dressing for somebody who doesn't want to take anything and you want to sneak it into their food. Number two way is there's the raw terpene is very effective as an aroma agent and a topical agent. So you've got a small bottle, and you can put a few drops on your skin or bruised area, rub it in, and you can get terrific benefits from using that. But it doesn't last as long in that way. In particular, there's an aroma factor that is highly, highly effective. And so if you smell beta-caryophyllene, often people, if they really like the smell, the aroma is so penetrating, it actually has major benefits on the lungs and the airways of the body, and it can enhance your feelings of relief and calming sensation just by smelling the aroma effect.
That's the terpene, the volatile terpene.
Yes. And that's been well documented. And the fact that it goes right to the brain, it goes through the olfactory connections, the olfactory function of the brain. It gets into the brain. It actually, I believe that it's going to open up the olfactory system and drainage of the brain to get out those toxins that are in the brain. Plus, it's going to have stimulating properties to the brain and calming effects as well, and neuro anti-inflammatory effects particularly. So there's a huge benefit from doing it that way. Now, you can also put the tincture on your lips or your gums, and you can brush your teeth with it as an anti-dental inflammation, and it will break up biofilms as well as counteract the bacteria that are in the mouth as well. And you can use it on a tooth that's painful. For instance, cloves have been used for centuries for dental pain. And so you can use the same thing with the beta-caryophyllene terpene. But I don't recommend swallowing it, the oil, because of that irritation you can have if you get too much of it. And then I've actually got a gel formulation.
Too much of the raw version.
Yeah.
Yeah.
Yours
isn't like that. Yours isn't like that.
No.
You can just take this all day long and it tastes like caramel apples to me. I love the flavor of this.
You can actually use the liposomes topically as well as orally.
Oh, I got rid of an old lady dark spot over here just by taking some and then dropping it on that right there, and poof, it's gone. It's gone.
Oh my God, that's fabulous.
It's funny. Yeah,
So I
it's
also
funny.
offer it in a gel formulation, which has got dimethylamino ethanol, and that's a it's a long standing cosmetic that actually stimulates the skin to the in, inhibit collagenase. So the breakdown of collagen in our skin is what makes us old, and this blocks that effect. So you actually get thickening of the skin, and you can take care of many wrinkles from using it.
Oh, wow. So is it a makeup cream?
No, it's actually an analgesic and an anti-inflammatory cream for rashes, and it's a serum. It can be used as a
Okay.
serum to correct for complexion issues. Now,
Okay.
you already talked about the lightening of the pigmented lesions. That's true for beta-carotenin. It lightens those pigmented spots as well.
It surely does.
Then I've got capsules, and the capsules are the powdered form of beta-caryophyllene. And so that comes in one with curcumin, actually turmeric, which is highly anti-inflammatory. That's the immunity blend. And then I have a metabolic blend that targets the metabolism of the body, and it acts like a GLP-1 agonist. And
I don't know
so
what it's a GLP-1 agonist.
Ozempic,
Oh,
Onjori.
oh,
So it works like that. It decreases your appetite. It gives you, it promotes a oxytocin in the body. And oxytocin is that feel good socializing chemical hormone that we release into the body. And it actually, it's one that's paramount in our relationships and establishes that. But it also inhibits the appetite. And by inhibiting the appetite, there's huge amounts of weight loss that can be achieved with using the compound. It contains oleol ethanolamide, OEA, which is actually an endocannabinoid substance that is naturally found in our environment, and just with a simple modification of olive oil.
oh my goodness. So many different products.
Five, just five.
Yeah, but what a world, what a spectrum that is for help. I just wanted to go back to your capsule again. You said it was ground and you had curcumin and turmeric in it?
Yeah, turmeric, not curcumin. That's right.
Okay, turmeric in it. Yeah.
Now, curcumin is contained in turmeric, but that's not specifically curcumin in the product. But it
Okay.
has a highly bioavailable, it's combined with black pepper, which actually promotes the absorption of the turmeric, and that's well established. And so when you take this product, you get two anti-inflammatory agents for the price of one, which is the beta-carotenin and the curcumin, and that affects the immunity blend. But it takes about an hour for that to take an active effect.
You are an encyclopedia of all of this. Is it okay for older people who are like on a handful of pills to take this?
Yes, it has no drug interactions, none. I've
No.
not encountered any drug interaction, any toxicity. There's no adverse side effects from using it. You can use it with any combination of medication, and there's nothing that's going to happen.
Have you ever heard of another compound that's like that? That you
No,
wouldn't get any warnings on? None?
no, never.
I haven't either. Sometimes I see a commercial on TV about, all those other and they're just terrifying now. They're just terrifying what the warning labels are saying. And, for you to be able to say that there are absolutely no interactions between those two, no, that's not contra-interaction.
Well,
Right.
I actually have to correct myself. There are interactions, but at the very positive standpoint. For instance, with chemotherapy, it sensitizes the body to the chemotherapy against cancer cells. So
Yeah.
that's an interaction, but it's a
Yeah.
very positive interaction. Plus, it prevents the toxicity of these chemicals on the body, on normal tissue. So, yeah, there is an interaction, but it's a very positive one, and I've not been finding any negative aspects of it at all.
It's just incredible. Absolutely incredible to hear. How important do you think mindset is to all of this?
Well, a mindset, that's sort of lifestyle arrangements. So the mindset is a lifestyle factor that has to go into the endocannabinoid system. So we balance our endocannabinoid system with diet, with mindfulness, with exercise, with nutrition, with sleep. And these are all important factors. So mindset is a key factor for our relaxing and calming our endocannabinoid system and putting it in a normal state. And that's what beta caryophyllene does if you need the extra help. So oftentimes the lifestyle is a factor in whatever type of problem that we're encountering, but we get to the point where the inflammation is too strong and we cannot get it taken care of with these lifestyle changes unless we do a major upgrade to our lifestyle, which is very challenging for most people. You know, changing over your diet, changing over your mindfulness, these can be very, very hard to do. Whereas beta caryophyllene can kind of kickstart it into getting more energy for exercise, getting more mindfulness in terms of gratitude and reward and pleasure. In terms of nutrition, you target eating better foods and avoiding addiction. And it's going to help your sleep as well. So it's going to hit on all the factors that are key for the endocannabinoid system to rebalance and reformulate the endocannabinoid system away from the dysfunctional one that's so common in our population today.
It'd be a whole lot easier just to take a few drops a day than to go to the gym.
It would be, but that's not what I'm advocating. I'm advocating for a combined approach with lifestyle and beta caryophyllene, but it actually can get you kickstarted, for instance, with exercise.
It really
can really
does.
energize you and you get out there and do more things.
And you feel happier and you take pleasure in the smaller things.
Exactly.
You notice that, the air smells good. You notice it's, the grass. You notice how bright the sun is shining, how pretty the flowers are. You notice that the little stuff that you forgot about in all your misery. When you're miserable with pain, whether it's anxiety, inflammation, or acute pain, that's what's speaking in front of every thought. So to have something that can settle, here's my question. Is the central nervous system inside the endocannabinoid system?
Well, the central nervous system is a system in and of itself, and the endocannabinoid system is a system of itself. But the endocannabinoid system tends to modulate the neurologic system. So it is one that restores balance to the neurologic system, and it's constantly signaling back and forth to orchestrate a better response from the neurological system. So you get neuroinflammation, that's a negative aspect. And so you want the endocannabinoids to calm that agitation down so it's much more peaceful. And then when you back off to normal and you incorporate lifestyle issues, then you're going to have a balanced system. But if it gets exacerbated and you get excitotoxicity, then you want the beta caryophyllene, you want the cannabinoids to relax that and calm that down.
If somebody out there in our audience is listening today and they're completely overwhelmed with their lives and their pain and all of that, how would you gently direct them?
Well, I would, first of all, I direct them to the thought lifestyle. Lifestyle is key important. You want to get those balance of the sleep. You want to get relaxation, calming effects. You want mindfulness. You want the exercise and the nutritional aspects. But if that's not effective for you, and you don't feel that you're able to do that, then I'd recommend beta caryophyllene as a starting point. And then if you go to my website, blairmedicalgroup.com, you can join that very easily and you participate. In fact, I highly recommend that you join a fellowship. Now, the fellowship is highly valuable in that it opens up a large amount of educational content for you. And you can go to that in the resource hub at the website in the menu items. And we're coming out with a number of different videos and audios, as well as white papers that I've written that explain the benefits in different areas of the body with the use of beta caryophyllene in particular. So I'd highly recommend that. Now, if you're going to do this, I would recommend starting with the beta caryophyllene liposomes because you can titrate that to your exact need. If you're an extremely sensitive person, then you might only need a few drops. But if you're resistant, you may need 2 milliliters. It's highly variable in terms of the dosage that people need. Generally, I recommend 1 milliliter twice a day, but some people have to take two, and some people can get by with 5 drops, and they can use it all day. And they can use it. I recommend using it twice a day because the duration of effects tends to be 12 hours. But there's some people that get 24 hours of relief with it, and it does enhance your sleep, but if you take it at nighttime, it can be activating to the body and to the mind, and that can prevent you from going to sleep right away. Now, when you do go to sleep, you'll sleep soundly and deeply for a lengthy time period as well.
Which is, as we all know, very restorative and healthy for you to get
For the endocannabinoid system as well as the neurologic function as well.
right, right. So, what do you wish more people understood about their health and how to take care of themselves?
Well, I wish people understood about the diet. I think diet is so key and important, but there's a lot of politicization of the dietary measures that are out there. The major culprit is refined foods and seed oils, and I think they're toxic to the body, and they've led us to a great deal of disease and hyperinsulinemia, in that the body produces a lot more insulin to counteract the sugars that we take in, and that converts to an inflammatory situation on the body, leads to obesity and to a great deal of disease. Whereas if you can cut out those highly refined carbohydrates, you can reduce that immediately and reduce the weight and inflammation of the body. So I think dietary measures are key and important in almost all disease categories, including psychiatry, as we now know, and cancer. There's evidence that a very low carbohydrate diet, in which a ketogenic diet, is highly protective against cancer, because cancer looks like it could be a mitochondrial disease. And so the number of surveys and number of examinations have gone into this, and they find that if the source of the cancer seems to be on the mitochondrial level from dysfunction of the mitochondria, and that's where people can restore the balance to the mitochondria with the proper diet. Now, it turns out that beta caryophyllene can help you get there by changing the metabolics of your body, reducing insulin and improving the mitochondria, actually proliferating mitochondria in the body and changing their metabolism specifically. So that's one of the cancer prevention properties, and one of the properties that I think that overall everybody should be using in a dietary form, as well as the beta caryophyllene for stimulating the body in the proper way.
Do you remember when people used to get large goiters on their necks? And that was caused from
Iodine deficiency.
And so the government did what?
Yeah, mandated that. Well, they made it available. Iodine was available in salt, and so iodine was added to salt in general distribution of salt products.
I wonder if we could get the government to see the benefits of BCP and do something similar.
Well, they've talked about that for use of statins in the water supply, but that's not going to go anywhere. So I don't think that that's going to be a good idea. People are going to object to being mandated. Anything by the government mandated is going to be looked upon by a significant population as being a very negative aspect.
But that did work, did it not?
Yes, it did.
Yeah.
But you can now buy salt without the iodine in it, and it's becoming very popular. And there's actually been a recrudescence of a goiter as a result, and thyroid disease.
Why would anybody buy salt without that had not been iodized?
It's a taste factor. You can actually taste it, and it's a negative taste factor. Or they're looking for the pink salt from the Himalayas,
That's right.
and from salt deposits in England. They're highly valued, and in Mexico, they're highly valued for
Because
their
they have more
blend of salts.
in the salt, right?
Yeah,
Which are better for your body.
yeah.
We just have to get smarter as a society. And fortunately, we've got you, dear Dr. Blair, to help us get there. So, how can our audience get in touch with you and find out more and start doing their own research and get their own product?
Well, the first place I'd go is blairmedicalgroup.com. And that's the best place to go. And there's lots of information. You can contact me for a consultation, and I think I'm happy to consult with people. What I really like to do is have people sample the beta-caryophyllene on a video call, and I can talk them through the benefits and answer any questions if they use it in this way. So I check them out and do a self-assessment or do assessment beforehand, and then I have them take the product, and within 10 minutes they usually see magnificent changes.
That's
and I reinforce that.
Yeah, that's brilliant. I love that. That's brilliant. That is so cool. All right. Well, I can't wait for my friends here to see this podcast, and I'm just so grateful that we're friends and that you could come on and help our society understand they've got alternatives and they can feel better, and there's new technology out and available. So this has been wonderful, and I can't thank you enough, Dr. Blair.
Well, this is kind of old technology that we're reapplying in this case.
Yeah.
But it's ancient, and it's hugely valuable. And that's my mission in my professional life right now, is to transform people's lives with beta-caryophyllene. And so I really appreciate what you're doing, honey, and getting the word out and meeting the needs of so many people and understanding these complex and difficult subjects, like the benefits of the endocannabinoid system and beta-caryophyllene. Thank you so much, honey.
We'll see you next time, all right? Thanks again for coming. Bye, everybody.
She's the queen of the green with nothing to hide. Oh, honey, no.
You've been listening to another Cannabis Truth podcast with 21st century cannabis shaman Honey Smith Walls. Using cannabis mindfully as medication is a different concept in Western healthcare philosophy, specifically over the past century. There's a lot to learn and reconsider. The scientific truth of cannabis is finally getting out and is wide open for all to see at respected medical sites like the National Library of Medicine at pubmed.gov and the Journal of American Medical Association at JAMAnetwork.com. We here at the Cannabis Truth Podcast are right there in the thick of it, alongside the titans of medicine, as a fly on the wall. We are not doctors, nor did we go to medical school, but we have taken dozens of private cannabis courses and still engage in continuing education offered by expert cannabis scientists. Over the past few years, we slowly began to see and understand the bigger picture. Now we hear from people all day long about cannabis. It is so important to use verifiably safe products. The process of getting a diagnosis from your family doctor and taking your records to a cannabis specialist can lead you to the correct cannabinoid therapy for your specific issues. Otherwise, you're simply your own guinea pig looking for answers without the foundational knowledge or ability to determine your best strategy. To find a qualified cannabis expert in your area, visit cannabisclinicians.org. This is a national society of cannabis experts. Look for the link in the show notes. Unless otherwise proven by a reputable third-party lab test, please regard all street weed as contaminated. It may do grave harm to a patient with a delicate immune system who already has inflammatory issues like arthritis, IBS, fibromyalgia, or worse. Thank you so much for your time today. I hope you find value and understanding through the conversations you've heard on this podcast.
She walked in with wisdom and a fire in her eyes, talking plant truth where the silence lies. From the roots to the bloom, she saw the light. Now she's teaching folks how to heal it right. to challenge the tale of lazy myths and a system that failed. She's got science in one hand, stories in the other. Lifts up the voices they tried to smother. Honey knows, honey grows. Truth in the soil and love in the smoke. Speaking for the elders and the ones left behind. She's the shaman of the leaf with a warrior's mind. Yeah, honey knows how the healing flows. From Florida sun to digital waves, she's breaking down fear with every word she says. Cannabis truth, that's her battle cry. For the mamas and papas still scared to try. She ain't selling hype, she's serving facts. Taking big pharma to school with class. With a mic and a mission, she lights the way for the lost and the curious every day. Honey knows, honey grows. Truth in the bud and peace in the dose. Teaching the plant like a sacred art. From the ECS to the beating heart. Yeah, honey knows how the healing flows. She's been burned by the system, lifted by the plant, giving voice to the ones who thought they can. A sister, a sage in a world full of smoke.